This is Radio Health Journal. I'm Reed Pence. This week, how the pandemic has hurt women in the workplace most.
No one is going to go to a restaurant if they think they're going to die. So it really is important that we get the pandemic under control. Otherwise, it'll basically just be wasted money.
Getting America back to work when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Even though it's been an incredibly stressful time, I think some of those adaptations that have been made in order to cope will become more permanent.
How are suburbs shifting to meet modern needs? Then
we had rain in January in the high Arctic, which is not something that happened at all when William Barents, my navigator explorer, was there more than 400 years ago.
The noticeable changes in the icy northernmost region of our Earth. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
COVID-19 made itself a big part of people's lives not quite a year ago. And ever since then, precaution and job losses have been locked in a struggle. When we keep people at home to cool the pandemic, unemployment skyrockets. If we open things up to get people back to work, COVID cases surge. So it's a stalemate, at least until the vaccine kicks in for good.
There was a huge job unemployment that started in March and continued through April, where we lost 22 million jobs in 2 months alone, which is just unprecedented for the American labor market. And following that, and about the 4 months following the first sort of springtime job losses, we gained back nearly half of those jobs. So that's a pretty big partial recovery through the summer. But then the pace has slowed significantly since then. So from September to November, we only added about 1.7 million jobs back. And then the number of jobs being added back each month started to slowly decline. And then by December, we started to see job losses again.
But Dr. Kate Bond, Director of Labor Market Policy for the Washington Center for Equitable Growth, says pandemic job losses and their flat recovery have left some groups in much worse shape than others. Women lead the list of hardest hit.
Face-to-face public services are limited, and these are jobs that disproportionately are held by women, and in particular, women of color. So as long as certain sectors like hospitality and leisure can't recover because we really do need to maintain social distancing, we're not going to be able to add those jobs back. The second effect that's been happening is that, as with many recessions, state and local budgets are hit hard and public sector work can start to decline. And that is another sector of the labor market where women are overrepresented as well as Black workers are overrepresented. What really concerns me about the loss in public sector work as well is that these tend to be pretty quality jobs for women and Black workers. They're losing a lot of middle-class jobs. And then the other big factor, of course, affecting workers is this big universal care shock facing families.
A lot of the layoffs were disproportionately impacting women, and even then, especially women of color, Black women in particular, have been very hard hit.
Dr. Jeff Hayes is Chief Data Analyst at the Institute for Women's Policy Research.
If you look again in leisure and hospitality, I looked at the data from January of last year through December, so what happened within the 11-month span across the 2020, and we're down overall about 4 million jobs in leisure and hospitality, 1.2 million in education and health, 1.3 million in government, and that's, again, something that people are expecting to actually, I think, continue up now, that as governments start to run out of funds and things like that.
However, women have been hard hit through far more than just the fields they work in. With schools and daycare closed, who's taking care of the kids?
It's women who still disproportionately end up doing a lot of the childcare. So they were doing a lot more of that. There have been homeschooling by demand, or distance education managing, not, I guess, formally what we might think of as homeschooling, but, managing the schooling and things like that for their kids to a much greater extent. And even if you do work outside the home, still and continue to work outside the home, or even part-time or something like that, if you're doing like an A-B schedule at your office or something like that, It's the women who really are still predominantly staying home with kids and things like that and trying to do the best they can. And you've just been asking a lot of them.
Hayes and Bond say even women who haven't been laid off have been on a slippery slope. With kids at home, many have had to quit their jobs because they have no other choice. Working from home is no guarantee that it'll all fit together either.
Trying to also manage the education remotely has been extremely difficult. It's varied widely across school systems. A very hard time doing the remote learning, the remote education for kids and managing it. And so even those that are not necessarily still working, but trying to work from home and maintain, high productivity and things like that, were hit hard by trying to do the schooling.
This is going to be a huge factor for families. Mothers as well as fathers of young children have reported more absences from work. So maybe they are still employed, but they're going to be just taking more time off of work at pretty alarmingly high rates. And then also, as of November, nearly 400,000 mothers of young children dropped out of the labor force, and over 200,000 fathers of young children also dropped out of the labor force. So the numbers are really showing that is a huge number of people who are dropping out as they're trying to manage caring for their young children, essentially operating a homeschool or a daycare, and it just makes it impossible to also work at the same time.
Kids at home and moms who can't work as a result are among the reasons why the Biden administration is intent on getting students back in the classroom. Families are squeezed, and women who've lost a job have a tough time looking for a new one.
Women who are responsible for caregiving and who are losing jobs are being really hit on both sides. So both they have caregiving responsibilities, and if their jobs are the types of jobs that typically are done outside the home and cannot be done remotely from home, they simply cannot be going out to work while also caring for kids who are home. And those women are the exact same workers who tend to be paid less generally, so they're going to have less of a financial cushion to be able to pay for childcare so they can go look for a job or go back to a service sector job. Research shows that women definitely face more constraints when they're looking for a job. So it might be something like the commute you have to be limited because you may have to go pick up a kid from school. It may be that your hours have to be more limited. And so ultimately, it makes women have fewer options for jobs that they could have, and that will make them appear to employers as if they are less pay sensitive, which employers will in turn exploit by underpaying women too. So it's this sort of double bind where women have fewer options, and because they have fewer options, employers can pay them less.
The result of all this is that women have left the labor force in far higher numbers than men. They're not looking for work, and that has many ramifications.
We've lost 843,000 jobs, or fewer women are employed, fewer black women are employed in December of 2020 than in January 2020. So of that 843,000, 2/3 of the black women was a reduction in the labor force, and about 1/3 was unemployed, whereas it's much more 50-50 for white women in terms of left the labor force versus unemployed. So if you leave the labor force and you stop looking, again, you don't get unemployment insurance compensation. So you would lose eligibility there. You would not get, again, the $600 or $300 extra dollars each week to support your family. Again, so you're really a bunch of the safety net is no longer available to you.
When people leave the labor force in large numbers, it also has ramifications for the economy because those people are no longer counted as unemployed. That makes the jobless rate look a lot better than it really is. Michael Matowitz is an economist at the Center for American Progress.
It is worth sort of unpacking the unemployment numbers because I think a lot of the most optimistic takes on how the recovery is going center on 6.5-ish% unemployment rate, which really isn't that bad historically. I think if you look at it through the lens of women, it's really easy to see what's going on here because lots of women are at home supervising children, doing other care work, way more than you would normally expect. And because they're not actually looking for work, they're not showing up as unemployed, and that's how you get a 6.5-ish% unemployment rate with 10 million fewer jobs than you had a year ago.
But will those jobs ever come back? Many experts are concerned that they won't. Matowitz says low-wage jobs are likely to have the weakest recovery, and with little safety net, Bond says long-term income levels may never recover.
An increasing proportion amount of people who are out of work are permanently laid off. They are not temporarily laid off and expecting to go back to work. That is really concerning, but why that is concerning for me in the long run is that if you are hit hard, if you lose your job permanently, it means that once we get to a recovery, you may still have sustained lower levels of income and sustained lower levels of employment, and it can take years beyond once we're technically in a recovery. It can still take years for those workers who are hit the hardest to actually sort of get back on a level footing.
I'm somewhat surprised that I don't hear this brought up more often. I mean, I think, if you talk to economists roughly a year ago, there was kind of hope that we were going to put the economy into a coma for a month. And then once we'd gotten past this virus, we were going to wake it up and everybody was going to go back to their jobs. And so a lot of those employers have gone under since then.
So what can we do about it? Matowitz says clearly nothing else can happen until the pandemic is under control.
The absolute first thing we have to do is get people vaccinated. I can come up with any plan I want right now for expanding employment in restaurants and cool promotions for chef weeks and stuff, and no one is going to go to a restaurant if they think they're going to die. So it really is important that we get the pandemic under control before we move on to ways to bring back employment, because otherwise it'll basically just be wasted money. So getting the pandemic under control, clearly job one. And once you do that, I think we are going to have to do a fair amount of economic stimulus. We know we've lost a lot of state government jobs, local government jobs, teachers, firefighters, cops. A lot of those people are going to have to get rehired, and unless tax revenues magically rebound much faster than they have previously, we're going to need some federal money to make that happen.
Bon agrees the pandemic comes first, but the economy is so bad that people may not be able to keep their homes or put food on the table long enough to be hired for those new jobs. She says direct relief to families is also a must.
We know some of the best forms of direct relief are going to be really generous unemployment insurance that helps the workers who are losing their jobs sustain their incomes. And it's a really simple way to target money towards folks who are losing their jobs. And then the second one is going to be direct relief, like the relief checks that have been proposed in different relief packages. And so I think that is we need to just get families' incomes whole until we get to the other end of the public health crisis. And then I think as we look towards an eventual recovery, I think we need to really center job quality because, as I mentioned, that there can be these long-term effects of crises.
You can't spend your way out of everything, but interest rates are staying low, and I think that's an important point to make, that the government can now still borrow at very low rates. And to think that you're writing off even a chunk of your economy would also be a mistake, that we need to be thinking about reinvesting and rebuilding these sectors that were so hard hit. And again, to stop talking about this as a once-in-a-century thing, you just don't know when it might happen again. I think we need to be rethinking our programs and our support system and things like that.
For Hayes, that means building in supports for child care, paid sick days, automatic unemployment payments, retraining, and a living wage. Some of the things that could have made the COVID economic crash less disruptive and women less of a target for its destruction. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
There's been some evidence now that possibly the risk of heart attack stays elevated during the duration that we are on daylight savings time.
What happens to the mind and body when we spring ahead every year?
Then the increase in sexually transmitted diseases despite pandemic shutdowns.
I think people's pandemic fatigue has sort of hit a wall, and I've just noticed that patients are out there dating again and therefore getting STDs.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.